Hi guys! Today I want to speak on the topic of patch tests. There are a lot of discussions in the internet, Facebook professional groups, so I've decided to tell you my opinion and share my experience. So what is actually a patch test? A patch test is a procedure that you do to your client to know if the client will react on your glue or not. Patch test is a procedure when you put a few lashes, like from 4 to 15, on the outer corner of each eye of your client. And then your client goes home and spends around 3-4 days to be sure that she will not react on the product. Patch test can show allergies if the client is very prone to allergies and she is very sensitive, so she will definitely know if she's okay with the product or not. But on most people, even if we do a patch test, it is not 100% you will know if she will react when you put her a full set. Just to count the lashes that you put on and the amount of product, we put 40 times more glue than on a patch test. So you can imagine it doesn't show you the real picture of client's behavior, of client's organism's behavior. There is some false information about the patch test can be made by placing one drop on the skin behind the ear. Don't put your glue on the human skin, especially your client. Of course, sometimes we just mess in the glue drops or some stuff. Well, I know the risks. I know what to do because I have the instructions from the manufacturer, which is called a safety data sheet. Is it mandatory to do a patch test? Okay, if your insurance company requires you to do patch test to every client, you have to do that. Also, I do patch tests to all brides because, wedding, it's a exceptional event in your life, and even if you're okay with any kind of cosmetics and allergies, then I would do a patch test still to know for sure that the best day of the life will not be spoiled. But what to do if your client may have an allergy? Okay, in the consent form that you have in your studio, there should be a statement about allergic reactions, because we're not doctors, we cannot guess if she will have allergic reaction or not. So the only place where she can do that, where she can 100% know if she will react, it's a doctor, it's a blood test. There is no patch test that will show 100% if she's allergic or she's not. Also, there is a thing that in time she can react still, like in 2 years or 3 years, if she's sensitive. The only way is to go to the doctor and make some blood tests, like for example for carbon allergy or cyanocrylates. I've never done that, so I'm not sure if I'm telling the right thing to tell the doctor, but actually only the blood test can show. So first thing, your client has to understand that we're not responsible for any allergic reactions, and we cannot possibly be. So if she knows that she's very prone to allergies, she has maybe some allergic reactions for cosmetics on the face, maybe mascara or eyeshadows, that's the risk factors. Of course, there are some factors that doesn't allow you to do eyelash extensions at all, but except of that, she has to know if she's allergic to everything or she's not, because if she's allergic to everything, she's very prone to allergies, then probably she will react to your lash set. So when you have to do a patch test and when you don't have. You have to do a patch test when your insurance company requires. In any other conditions, you don't have to do that. But I would advise you to do patch tests if the person comes for the first time, especially if she doesn't know will she react or not, and if she knows that she's not prone to allergies, because if she tells me like I'm prone to allergies, I would probably refuse to do her procedure at all. That's a big risk. So the first time client does the patch test. Brides do patch test because I don't want to spoil the best day of the life. What else? That's probably it. Just 2 main conditions and insurance. In all other cases, you decide if you want to do patch tests or not, but it takes too much time and doesn't show everything 100% if the client doesn't do blood tests. That's it. I hope this video was useful. If you have any other information from what I have, feel free to comment and I will definitely read that, and we may have an interesting discussion. And if you like this video, subscribe my YouTube channel, follow my Facebook group where you also can ask any other questions. See you in the next videos.